I really think that we have to go back just a couple of months and recognize that even if we had any hope that there would be a successful vaccine, I don't know, maybe 70, 80%, I'm 50 to 60 for the flu was something that we've learned. I was critical of Moderna. The insider selling was bad. Well, it turns out the insider selling was bad, meaning that they sold badly. I do think that what's happened here is we have kind of vaccine Monday, David, where we have merger Monday, we have vaccine Monday. And I think that next is going to be not RNA, it's going to be AstraZeneca. David, you continually, I think, wait for what we really need. The bridge is not just masks. The bridge is therapeutics. And that's something we haven't been good at.
No, and it looks at this point as though, Jim, the vaccines are going to be out before we get real therapeutics. Now, Eli Lilly's monoclonal antibody has been already approved for emergency use, but there's not a lot of it available.
Right.
When you're talking about 150, 160, who knows, 200,000 cases we may have pretty soon a day. That's just not feasible because that's supposed to be infused early to avoid any real complications, Jim. So the hopes for antivirals proceeding and being that bridge to a vaccine, I don't know. They'll still be out there, though, when a lot of people are not vaccinated and therefore still be available in that same time when we're starting to vaccinate people, but other people are getting sick. Hopefully the antivirals will be available then so that really we can, a lot of people can feel a lot more comfortable in terms of leading a normal life again.
Right. I mean, Carl, I think that when we see numbers like today, what happens is the airline stocks immediately go up and the hotel stocks and the retail stocks. And then what happens? Well, Norwegian Cruise, the numbers are cut because there won't be any sailing till March, not January. American drops some very key and lucrative routes. So the younger buyers, and I do think that the younger buyers who can't wait and have to buy at 4 a.m., 5 a.m., 6 a.m., they just are so enthused. And then the facts come, and the facts just don't fit the story. They do make you feel like it will eventually be good, Carl, but I just don't get the sense that we're going to go on a cruise in the next 4 months. I just don't think so.
Yeah. Although, Fidelity did some charts last night looking at the Goldman baskets, the reopening basket, the stay-at-home basket, and the stay-at-home is hitting lower highs, and the reopening, although way behind, is trying to catch up.
Well, look, I think there are a lot of companies that are going to adjust. You see a stay-at-home company, they can do different things. They're not just sitting there and saying, okay, listen, I want to go take a beating. Now, Peloton doesn't have much of a chance. I think Netflix does if they do the right product. I have Teladoc on later this week. I don't think Teladoc is something that comes and goes. You may say it's inflated. DocuSign with a great deal with Zoom. I think these are things that are here to stay. David, I do not hear anybody saying, you know what? We are going to return to the heyday of when we put people on planes and spend a lot of money, because the gross margins have been terrific for a lot of companies that can do things by Zoom.
There's no doubt that a lot of companies have been able to save a great deal of money on T&E and on travel, well, on so many of those things, as you say. For some companies, it barely moves the needles. For others, it is a major savings, Jim. And as we've said many times, listen, we can all sit here and still talk about what things will be like when the coronavirus, hopefully and thankfully, is gone, or at least neutered. But, we don't know. But I think we can assume fairly that business travel will not be back to the levels it was in 2019. Perhaps not ever, or certainly not for a long period of time.
Shepard Smith here. Thanks for watching CNBC on YouTube.